You have probably reached for medicine when you felt something coming on. That familiar heaviness behind the eyes. The throat that feels slightly different than it did an hour ago. The body sending its first quiet signals that something is changing. And most people, when they feel that, reach for a pill, a tablet, something from a box. But here is what people reached for thousands of years before the box existed. Two things, both of them in your kitchen right now. One of them sweet, one of them sharp, and together, something that battlefield medics trusted with infected wounds, that ancient physicians prescribed for the lungs and the heart, and that modern laboratories have now tested against some of the most resistant bacteria on Earth. Within seconds of taking this combination, your body begins to respond. And within days, many people notice something even stranger. Their mornings feel steadier, their chest clearer, and their energy less dependent on caffeine. And the response is not subtle. There is a preparation that appears in the oldest medical records in the world. Not one culture, not one continent, not one era. Ancient Egypt, ancient Greece, ancient India, ancient China, medieval Russia, Viking longships, World War battlefields. In every one of these places, in every one of these times, healers were combining the same two ingredients and using the preparation for the same purpose. Infection, immunity, wounds, the chest, the blood. And here is what makes this unusual. When modern researchers took this combination into a laboratory and tested it against bacteria, including bacteria that have evolved to resist pharmaceutical antibiotics, they found something that the ancient world had been quietly observing for 4,000 years. The combination does something that neither ingredient does alone, something that even modern medicine is paying attention to. And for the people who use it consistently, not once, not occasionally, but every morning as a practice, something else begins to happen. Something that is harder to measure in a laboratory, but impossible to ignore in a body. Energy that feels different. Digestion that settles. A quality of alertness that arrives without caffeine. Skin that begins to look like it is being fed rather than depleted. And a clarity, mental and physical, that most people had stopped expecting. The ancient world called this the result of giving the body what it already knew how to use. We are only beginning to understand why. One of them has been used as a wound dressing for thousands of years, its antimicrobial properties so powerful that it has been found still preserved in 3,000-year-old tombs. The other earned the name Russian Penicillin on World War II battlefields, used by field medics when pharmaceutical supplies ran out. Together, they form one of the oldest and most consistently documented healing preparations in human history. Honey and garlic. And what this combination does inside the body, when taken together, consistently, every morning for 7 days, is something that goes far beyond what most people expect from two things they already own. If this is already making you think differently about what is sitting in your kitchen right now, subscribe. Because what these two ingredients do together is one of the most well-documented stories in the history of natural medicine. Here is where this story starts, and it starts in a tomb. When archaeologists excavated ancient Egyptian burial sites and medical storage rooms, they found honey, sealed in jars, some of it thousands of years old, and in several instances, still edible, still active, still carrying the same antimicrobial properties it had when it was sealed. No other food substance on Earth has this property. Honey does not expire, it does not rot, because nothing can grow in it. The ancient Egyptians understood this, not through chemistry but through observation, and they used it accordingly. The Ebers Papyrus, written around 1550 BC and containing over 900 medical remedies, lists honey as a component in the majority of its preparations, for wounds, for the chest, for the stomach, for infections. And alongside honey, in preparation after preparation, garlic. Hippocrates, who appears in this series more than almost anyone else for good reason, prescribed the combination specifically for pulmonary infections. Infections of the lungs and chest, the conditions that, before antibiotics, killed more people than almost anything else. He was not prescribing it because it tasted pleasant. He was prescribing it because he had watched it work. In ancient India, the Ayurvedic system classified honey and garlic together as among the most powerful immune tonics in the entire pharmacopoeia, not for the sick only, for the healthy who wanted protection, for the warriors and laborers and travelers who needed their bodies to remain resilient in conditions that broke other people down. In ancient China, a specific preparation emerged that has survived in traditional practice to this day: garlic cloves submerged in raw honey, left to ferment for weeks, sometimes months. What forms during that fermentation is something different from either ingredient in its raw state. The Allicin compounds in garlic transform into more stable, more bioavailable forms. The honey deepens in complexity. The two become something neither was alone. This preparation, fermented honey garlic, was used by Chinese emperors as a longevity tonic. It appeared in the medicine of physicians treating the court, and it has been passed down, essentially unchanged, for over 2,000 years. Viking warriors, who spent months at sea in conditions that destroyed the health of most men, carried garlic preserved in honey as their primary field medicine, not for flavor. Because they had learned, through generations of hard observation, that this combination kept infection at bay in open wounds and kept the chest clear in the cold and wet of long ocean voyages. And in Russia, where the combination became so embedded in folk medicine that it has never fully left, honey and garlic was the household answer to almost every illness: colds, chest infections, fever, intestinal complaints, passed down from grandmother to daughter across centuries, prepared in the same way, trusted with the same confidence. They were not being superstitious, they were being empirical, in the truest sense of the word, observing, recording, repeating what worked. Raw honey and raw garlic taken together is already powerful. But the traditional preparation that appears across ancient China, Eastern Europe, and the Middle East goes one step further: fermented honey garlic. The preparation is simple, but the transformation it creates is not. Peel a full head of garlic, individual cloves, intact, uncut. Place them in a clean glass jar. Pour raw honey over the cloves until they are fully submerged. Seal the jar loosely. Fermentation produces gas and the jar needs to breathe. Store at room temperature. Over the first week, something begins to happen. The garlic releases moisture into the honey. The honey thins slightly and begins to bubble gently. The cloves darken. The smell changes. The sharpness of raw garlic softens, deepens, becomes something more complex and less aggressive. Over 2 to 4 weeks, fermentation completes. What remains is garlic that has become almost sweet and deeply savory simultaneously. The Allicin compounds transformed by fermentation into forms that are more stable and more readily absorbed, and honey that has taken on the full medicinal character of the garlic while retaining all of its own antimicrobial biology. Why does fermentation matter? Raw allicin is unstable. It begins to degrade within hours of being formed. Fermentation converts it into organosulfur compounds, specifically ajoine and diallyl disulfide, that are more stable, more bioavailable, and in some studies more potent than raw allicin. The ancient Chinese physicians did not know these compound names, but they observed that fermented preparations work differently, more gently on the stomach, more sustained in their effect, more consistent in their results than raw preparations. Modern chemistry has confirmed why. What were ancient healers paying attention to across 4,000 years of using this combination? The most consistent pattern is immunity. Across every culture that documented this preparation, the observation was the same. People who took it regularly seemed to resist illness differently. They recovered faster when they did get sick. And in the contexts of genuine medical crisis, battlefields, plague years, harsh winters, they survived in higher numbers than those who did not. This was not invisible. It was not difficult to observe. When you are watching hundreds of patients across decades of practice, the patterns emerge clearly. The second consistent observation was the chest. Infections of the lungs and respiratory tract were the primary killer in most of human history. And honey garlic preparations appeared in culture after culture, specifically for chest infections. Not for general wellness, for the lungs. Something about this combination reached the respiratory system in a way that individual ingredients did not. The third observation was blood and circulation. Ancient Persian physicians prescribed this combination for what they called unclean blood, a concept that maps roughly onto what we might now understand as elevated lipids, chronic inflammation, or sluggish circulation. The observation was that people who took it regularly had clearer skin, better color, more energy, signs of blood that was moving cleanly and doing its work. They were watching the cardiovascular effects without having the cardiovascular vocabulary. When modern researchers put honey and garlic into laboratories, they found something the ancient world had been quietly observing for millennia. The combination is synergistic, not additive, where 1 + 1 = 2. Synergistic, where 1 + 1 equals something greater than 2. A study testing honey and garlic against multiple bacterial strains, including Staphylococcus aureus, E. coli, and Salmonella, found that the combination inhibited bacterial growth more effectively than either ingredient alone at equivalent concentrations. In some cases, the combination was effective against strains that each individual ingredient could not fully inhibit. This matters because it explains something ancient physicians were noticing, that the preparation worked in situations where the individual ingredients seemed insufficient. The mechanism is now understood. Honey's antimicrobial compounds weaken the outer membrane of bacteria. Allicin penetrates that weakened membrane more effectively than it can penetrate an intact one. The two create a pathway that neither could create independently. This same principle applies to MRSA, the antibiotic-resistant staph infection that kills thousands of people in hospitals every year, and against which most pharmaceutical antibiotics are becoming progressively less effective. Both honey and garlic have been independently shown to inhibit MRSA. Combined, their effect against it is among the most consistently documented in natural antimicrobial research. The cardiovascular findings are equally significant. Garlic has been shown in multiple controlled studies to reduce systolic blood pressure by 8 to 9 points, comparable to certain pharmaceutical antihypertensives. Honey has been shown to reduce LDL cholesterol and total cholesterol through its antioxidant activity. Together, they address cardiovascular risk through multiple mechanisms simultaneously: blood pressure, lipid profile, arterial inflammation, and oxidative stress. On the immune system, both honey and garlic independently boost natural killer cell activity. Natural killer cells are the immune system's first responders, the cells that identify and destroy infected or abnormal cells before a full immune response is even mounted. The combination of two NK-boosting agents in a single daily preparation creates an immune environment that is measurably more alert than the baseline. And on the gut, honey's prebiotic compounds feed beneficial bacteria in the microbiome. Garlic's allicin selectively inhibits pathogenic bacteria while supporting beneficial species. The two work on the gut from complementary directions, one feeding the good, one suppressing the harmful. 7 days of this every morning begins to reshape the gut microbiome in ways that affect immunity, mood, digestion, and energy simultaneously. So we decided to pay attention the way the ancient world paid attention. Not with laboratory measurements, not with bacterial cultures, just with the body, and with 7 mornings. 1 fermented honey garlic clove, eaten whole, every morning, before food, before coffee, before anything else. And here is what we noticed. Day 1. The first morning is about the experience of the preparation itself. If you are using fermented honey garlic, the clove is softer than raw, the sharpness of garlic transformed into something deeper, sweeter, more complex. The honey that coats it arrives first. Then the warmth of the garlic follows, slower and gentler than raw, but persistent. The stomach responds warmly. The body feels like it has received something substantial, not just flavor, but something with weight and intention. Day 2. Something shifts in how the morning feels. a quality of readiness that was not quite there on day one. Some people notice their energy is more even from the moment they wake, less of the groggy, slow first hour. Some notice a subtle clearing in the sinuses and chest, not dramatic but real. The antimicrobial activity is already beginning its work in the respiratory tract. Day 3. Digestion. By day 3, the gut is responding to something new. The combination of honey's prebiotic compounds and garlic's allicin has begun to shift the microbiome environment. Some people notice they are less bloated by the end of the day. Meals feel like they resolve more cleanly. Others notice that the afternoon, the hours when sugar cravings tend to peak, is quieter than usual. Day 4. Day 4 is often where people stop wondering if it's working, but many people report a sense of resilience on day 4 that is different from earlier in the week. Less of the low-level vulnerability that can accumulate during a busy or stressful period. A sense that the body's defenses are more alert, more ready. This is consistent with what the research on NK cell activity shows, but experiencing it in the body is different from reading about it in a study. Day 5. Some people notice changes in circulation. Hands and feet that normally run cold feel warmer. The flush of warmth after taking the morning preparation seems to last longer into the day. The cardiovascular effect of garlic, the vasodilation, the blood pressure support, is becoming cumulative. 5 mornings of consistent input. The body is adjusting its baseline. Day 6. By day 6, something interesting starts happening. The body begins expecting it. Some people notice that on this morning they wake up earlier than usual. Not because they set an alarm, but because something in the body is ready before the alarm arrives. 6 days of consistent morning activation has shifted the rhythm of the morning itself. Day 7. The observation most people report on day 7 is not a single thing. It is a texture, a quality of the day that is different from a week ago. Energy more stable, digestion more settled, the chest and sinuses clearer. Sleep at the end of 7 days often deeper and more restful than it was at the start. For 7 mornings, the body has been receiving one of the oldest medicinal preparations in human history. And the body has been responding in ways that people have been describing for 4,000 years. The science explains the mechanism, the timeline documents the days. But neither of those fully captures what consistent use of this preparation actually feels like from the inside. This is the part most people care about. Because the goal is not just to understand what honey and garlic does, it is to imagine, clearly, specifically, what a version of yourself that has been taking this every morning for weeks actually feels like to inhabit. Energy. Many people begin noticing, somewhere between day 3 and day 7, that their energy has a different quality than it did before. Not higher necessarily, more stable, less dependent on coffee to start, less prone to the mid-afternoon collapse that most people have learned to manage rather than solve. Some describe it as the difference between borrowed energy and energy the body is actually producing. The morning feels less like an effort and more like a beginning. Focus and mental clarity. This is often the change people notice last but value most. Many people begin noticing a sharpness in the hours after taking the preparation, a quality of attention that is cleaner than usual, less scattered. The brain fog that accumulates from poor sleep, chronic low-level inflammation, and a gut microbiome that is not functioning optimally, it begins to thin. Some describe it as the mental equivalent of a window being cleaned. The view was always there. It is just clearer now. And for some people, this is the moment they realize the exhaustion they thought was normal maybe wasn't. Digestion. You may start feeling this as early as day 2. Meals that used to sit heavily begin to resolve more cleanly. The bloating that had become a background assumption, present after most meals, ignored because it was always there, quiets. Some describe a sense of the digestive system finally working with the body rather than against it. The gut has been receiving prebiotic support from honey and antimicrobial recalibration from Allicin simultaneously. After a week of that, it begins to feel different from the inside. Sleep. This is where many people are surprised. Sleep quality, Particularly the depth of sleep and the quality of the transition into sleep begins to shift after consistent use. The cardiovascular relaxation driven by Allicin, combined with the anti-inflammatory effect of the combination on the body's background tension, creates physical conditions that make deep sleep more accessible. Some describe waking up on day 5 or 6 having slept in a way they had not experienced in months, not longer, deeper, the kind of sleep where the morning arrives and the body feels like it actually rested. Mood and emotional baseline. Many people begin noticing, without expecting to, that their baseline mood has shifted slightly. Not dramatically, not in a way that feels artificial or chemically induced. More like a floor has been raised. The irritability that accumulates from poor sleep, chronic inflammation, and a gut microbiome under stress begins to ease. The gut-brain axis is real. The gut produces a significant portion of the body's serotonin, and a gut that is being consistently supported communicates differently with the brain. Some describe it as feeling less reactive, more steady, like the space between a stimulus and a response has grown slightly wider. Body feeling, warmth and circulation. This one is physical and immediate. Many people begin noticing by day 4 or 5 that their body runs warmer than it usually does. Hands and feet that have always been cold become less so. The flush of warmth after taking the morning preparation extends further into the day. This is the Allicin-driven vasodilation, blood moving more freely, reaching the extremities more effectively. Some describe it as feeling more inhabited in their own body, more present, as if circulation that was quiet in certain places has been turned back on. Cravings. This one surprises people consistently. Many people begin noticing around day 4 that the afternoon pull toward sugar, the reach for something sweet or stimulating to carry the body through the second half of the day, becomes quieter. The gut microbiome has been shifting. The blood sugar rhythm has been stabilizing. The body is producing its own steadiness rather than borrowing it from sugar or caffeine. Some describe it as the cravings losing their urgency, still present but no longer insistent. Not because of discipline, because the urgency itself starts fading. Inflammation and physical ease. For people who carry chronic low-level inflammation, in the joints, in the sinuses, in the skin, this is often the most noticeable change across the full week. Many people begin noticing by day 5 or 6 that something that had been quietly present for so long they had stopped registering it as a symptom has become quieter. Joint stiffness that was most pronounced in the morning eases faster. Sinuses that were always slightly congested begin to open. The combination of honey's anti-inflammatory antioxidant activity and Allicin's direct inhibition of inflammatory pathways creates a cumulative reduction in the body's background inflammation, and the body feels it as a general lightening. Skin and eyes. The skin is often the last to show change and the most visible when it does. Many people begin noticing somewhere between day 5 and day 10 of consistent use that the skin has a quality it did not have before. Less dull, less reactive. A clarity that shows most obviously in the area around the eyes, where chronic inflammation, poor circulation, and inadequate sleep tend to show first. The eyes themselves often appear clearer, the whites slightly brighter, the area beneath them less heavy. Some describe it as looking more awake than they have in years, without having done anything different in their skincare routine. The change is coming from the inside. And this is usually the moment people realize something uncomfortable. They had adapted to feeling tired, adapted to brain fog, adapted to inflammation. They thought it was aging. But sometimes the body is not aging. Sometimes it is simply undersupported. Aging and vitality. This is the cumulative effect, the thing that becomes most apparent not in a single day, but across consistent weeks of practice. This is usually the point where people stop thinking of it as just a remedy. Many people describe looking back after a month of using this preparation every morning, a sense that something that was slowly depleting has been reversed. Not dramatically, not visibly in the way a cosmetic procedure is visible, but in the energy, in the face, in the way the body moves and responds and recovers. Ancient healers called honey and garlic a longevity tonic, a preparation for those who wanted to stay vital, not just alive. That observation, accumulated across 4,000 years of watching people who used it consistently, was not an accident. Calmness. Underneath all of it, underneath the energy and the clarity and the physical ease, many people describe a quality of calmness that was not there before. Not sedation, not detachment, a groundedness. A sense of the nervous system operating from a slightly lower baseline of activation. The body is not fighting as hard. The immune system is not working against a microbiome under stress. The cardiovascular system is not straining against elevated pressure and oxidized cholesterol. Everything is working a little more freely. And that freedom, that reduction in internal friction, is experienced as calm. This is often when people stop asking what the preparation does and start noticing what it has already done. Option 1. Fermented honey garlic. Traditional recommended. Peel a full head of garlic. Place the cloves in a clean glass jar. Cover completely with raw honey. Seal loosely and store at room temperature. Wait a minimum of 1 week before using, 2 to 4 weeks for full fermentation. The preparation keeps indefinitely at room temperature. Each morning, eat 1 fermented clove with a small spoonful of the honey. Option 2. Raw honey and raw garlic. Immediate, effective. Crush 1 clove of garlic. Wait 10 minutes for Allicin formation to complete. Mix with 1 teaspoon of raw honey. Eat directly or stir into a small amount of warm water. The raw version is more intense, the garlic sharper, the effect more immediate. Both versions are valid. Timing. First thing in the morning, before food and before coffee. The compounds reach the digestive system and bloodstream before anything else competes with them. For enhanced effect, add a small pinch of black pepper, which increases the bioavailability of almost everything it is combined with, and a few drops of fresh lemon juice for vitamin C support. This combination appears in variations across Ayurvedic, Persian, and Arab traditional medicine and is not accidental. What to look for: raw, unfiltered honey, unheated, with the mother intact. Whole, fresh garlic cloves, not pre-peeled, not stored in oil, not powdered. The preparation depends on living biology in both ingredients, and living biology requires intact, minimally processed source materials. Honey and garlic in the amounts described are safe for most people. People on anticoagulant medications, warfarin, aspirin therapy, or other blood thinners should speak with a healthcare provider before making this a daily practice. Garlic has mild blood-thinning properties that can amplify the effect of these medications. People scheduled for surgery are typically advised to discontinue garlic supplementation 1 to 2 weeks beforehand for the same reason. Raw honey should not be given to children under 1 year of age due to the risk of botulinum spores in an infant's developing gut. People with reflux or GERD may find raw garlic, even in honey, irritating. Fermented honey garlic is significantly gentler on the stomach than raw garlic and is usually better tolerated by people with sensitive digestion. People with bee or pollen allergies should start with a very small amount of raw honey and monitor their response before making it a daily practice. And the rule that runs through everything in this series: start small. Start with half a clove or half a teaspoon of the preparation. Give the body time to adjust. Build the practice gradually. Consistency over months is always more valuable than intensity over days. Here is what stays with me about honey and garlic. Of all the combinations in this series, this is the one with perhaps the longest and most consistent record. It appears in the oldest medical papyri ever found. It appears in the records of battlefield medics across 2 world wars. It appears in the folk medicine of cultures that had no contact with each other. Viking longships and Indian Ayurvedic clinics and Russian grandmother kitchens all arriving at the same 2 ingredients through independent observation. And it appears in modern hospital research, where scientists are testing it against antibiotic-resistant bacteria because the bacteria have outpaced the pharmaceuticals, and someone remembered that there were tools that worked before the pharmaceuticals existed. There is something important in that last part. The bacteria have not learned to resist honey. They have not learned to resist Allicin. In 50 million years of evolution, because that is how old honey is as a biological substance, nothing has successfully evolved resistance to it. Pharmaceutical antibiotics, which have existed for less than a century, are already losing the war against resistant bacteria. Honey has not lost it yet. Maybe the oldest medicines are old for reasons that go deeper than tradition. Maybe the body knows something that the laboratory is still catching up to. Try this for the next 7 mornings: 1 fermented clove, 1 spoonful of the honey, before anything else. And then come back and tell me what you noticed. Was it the immunity, the energy, the digestion? Or was it the strange feeling that your body had finally stopped fighting itself, and you only realized how exhausted you had been once the exhaustion finally lifted?